the difference between adenomyosis and fibroid. Yes, it's important to talk about these two conditions because they at times look so similar and its presentation may even also be similar. When I say presentation, that means how the patient comes to complain in the hospital and all of that. Some of the similarities about this is the symptoms. Yes, there's usually pain. There's usually bleeding, heavy bleeding. There's usually abdominal swelling, tummy is swollen. You know, they present much alike, but then there's a lot of difference between the two of them. And one of the main differences about even from its definition, adenomyosis is actually a mass within the muscle of the uterus. And that mass is generating from the endometrium, that lining within the uterus, that is now growing within the muscle of the uterus. Meanwhile, for fibroid, it is actually the muscle of the uterus that is multiplying, becoming a tumor, and it is well circumscribed compared to adenomyosis that can be diffused within the muscle of the uterus. For that reason, when you feel the uterus, it feels more regular, more globular in the case of adenomyosis, but in the case of the fibroid, it can be lumpy, irregular, you know. And as I said, they usually present to those symptoms I've said before. But it's very difficult to separate them actually. The best way to separate them most of the time is when you have to open up these patients, and then you see that it's very easy to actually shell out the fibroid nodules. But in the case of adenomyosis, it's not easy at all. And another thing is that you can resolve fibroid issues with the surgery, but with adenomyosis, it may not be with the surgery, especially for women who are still interested in getting pregnant, you know. And then its management for adenomyosis is usually with medications. Meanwhile, with fibroid, you can resolve it even with the surgery. At times, medication is needed for the symptoms. But with adenomyosis, as I've said, you need medications to resolve the matter because it's actually some form of endometriosis within the muscle of the uterus called adenomyosis. It presents even in older women in the reproductive age, and usually with people who may have even had children already, unlike fibroid that is commoner with people with no children or few children, as it were. I decided to be kind of educative today. I hope you have learned something. Dupsi Digaini.